Hemorrhoids are basically enlargement, sort of an abnormal enlargement of the veins around the rectum and the anus that can cause symptoms. A lot of patients in our population, due to diet, suffer from some form of, symptoms of those hemorrhoids.
Hemorrhoids can be a very difficult thing for a lot of people. It can commonly cause itching, pain in the anal area, and even some spotting of blood either on the trousers or on the toilet paper. But it can also get more severe and cause more severe bleeding and more severe pain in the anal area. It'll come on suddenly for some people, and for some people it's there all the time. And so everybody kind of has a different response or different experience, unfortunately, with hemorrhoids.
It affects males and females of any age. We often see it around pregnancy, but we also see it throughout life. Our GI doctors can do banding of those hemorrhoids to try to reduce their size, but oftentimes those treatment options that are offered tend to be a little bit limiting in their effectiveness. Patients end up having the surgical options, which is going in and actually removing the hemorrhoids. It's an option, it's an effective option, but it's also a very long and painful recovery period.
So VIVA, we are experts at embolization. So we've applied this technique of cutting off blood flow to a organ or to a tumor, and we've done it for decades, and we are now applying it to hemorrhoids, and we're seeing great results from it. HAE is hemorrhoid artery embolization. So the concept is to cut off the blood flow to the hemorrhoids so that they shrink. It's all done through a very small nick through the skin, directing a little catheter to the arteries that feed the hemorrhoids and then plugging them up with little coils inside the artery.
The same day procedure done in clinic, very short recovery period. A lot of our patients often report no side effects or no pain afterwards, very minimal discomfort afterwards. Patients come in the morning, procedure itself in the room is about 25 to 30 minutes, and then recovery immediately afterwards for a couple hours. And then after that, for the first 48 hours, you're just recovering from the sedation. And really, there is no significant side effects or things to watch for after that. Patients don't necessarily report any discomfort. We see patients back after we're done with the procedure about, I would say, 8 to 12 weeks to see what their symptoms look like.
Having it done here at VIVA, an outpatient facility, is so much more comfortable than a big hospital. You come in, we'll take care of you that morning, and you can go home back to your bed that same day. And I think that's a huge improvement in terms of the way we treat patients. So when you have the HAE procedure done and those hemorrhoids shrink and go away, you can now sit again normally without worrying about if the itching or the pain's going to come on. You can actually go to the toilet and not worry about seeing blood in the toilet or when you wipe. You do feel like you're a normal person again, and you do feel like you gain your life back again afterwards.
It's very common. A lot of us go through it in life. It is important to speak about it. I don't think we live in a world anymore where we should be silent about our symptoms. If you have symptomatic hemorrhoids and that you've been dealing with for a while, and you want to consider a minimally invasive, highly effective procedure, come and see us at VIVA. We work closely with our surgeons here in town, with our gastroenterologists, and we've had great success with this procedure.